Hi, this is Monica Knoll with Cancer 101 here on the Podcast Go Network. We're here today to help you get through the first 24 hours of your breast cancer diagnosis. Step number 7, which specialist is right for you? So now you know the first specialist that you'll most likely see is a breast surgeon. The breast surgeon really is your captain. He or she will then recommend to you the oncologist that you should visit, the plastic surgeon should you need one, and any other specialists along the way. They work very closely and you want to accept their recommendations because it's nice to know that they all work together and they talk to each other and it becomes sort of a team working on your case.
I don't think that there's only one doctor to treat you. I think there's a lot of great physicians out there, a lot of great teams of people, and I do believe that sometimes you have to hunt around for who you think is special for you.
You have a responsibility to take care of yourself, and it's a way in which you also feel like you're getting some control of the situation as well.
In most cases, there is plenty of time for a second opinion. Your physician and your radiologist will certainly let you know how much time you have to make a final and ultimate decision. It's important to have a second opinion because there are choices to be made. Are you going to have a lumpectomy? Is it a mastectomy? What about a double mastectomy? These are big decisions to make. You need to have two opinions to make that ultimate decision.
I think that a lot of women who have been diagnosed with breast cancer or any other cancer do seek other opinions because there are more than one treatment option, and that's what we call it options.
Yeah, it's important to get second and third opinions because this is going to be a lifelong relationship that you have with these doctors. It just doesn't go away after your treatment's done.
Yeah, in my head, I knew I should probably get a second opinion, but I'd never had to do that before, and I didn't know if it would be considered insulting to the surgeon. But she actually recommended it before I even asked about it, and I was glad. I was glad of that because it made me feel comfortable getting another opinion. And when more than one doctor was telling me the same recommendation, it made me feel like, okay, this is really the right thing to do.
I think a second opinion is always warranted. I think when you start to get to third, fourth, and fifth opinions, you're doing yourself a disservice.
Another great way to learn whether a specialist is right for you is to ask to speak to their patients directly. This way, you'll not only get information about the doctor, but you'll also get a sneak peek at what to expect for your own process.
The other day, I had a patient in my office who wanted to know what a mastectomy would look like. What would it look like if she didn't have a reconstruction? And I had a woman in the other room, and she very graciously consented, and I pulled them together, and she was very grateful.
It was important for me to talk to somebody who was my age, who was a single woman, who had been through what I'd been through, and would talk to me about what to expect. And I was getting firsthand information because she had walked the path I was going to walk down.
Ultimately, this is a gut decision. Do you feel confident in your surgeon and comfortable with his or her recommendations? Do you like the other specialists? Are the other specialists and the surgeon open to your need to speak about your fears and your emotional needs? You'll know, you'll make your decision, and you'll feel good about it, I promise.
I had to feel comfortable with her. I had to feel that I could talk to her about anything, and there's a certain amount of chemistry that you have. There's gut and there's just chemistry. There's how do you feel with this person.
At the end of the day, in deciding, in evaluating all your the first opinion, second opinion, third opinion, if you got one, some of it really does have to do with chemistry with the doctor and how comfortable you feel with them, because you'll be spending a lot of time with them, and that's an important factor in making your decision.
So that's it for step number 7. I hope my information will help you make a decision regarding finding a specialist. For more information, go to cancer101.org. And don't forget to download step number 8. Thanks for downloading.